patients are often looking for whatever helps. And sometimes they get into a cycle of looking for things outside of them, including medication or supplements or CBD or whatever the case may be. But what that does is it takes away their own power. It can be disempowering for a patient to believe that the solution to that problem is outside of them. And that's not to say that there aren't helpful solutions and there isn't medication to take, but we can develop an over-reliance on those things and essentially disempower ourselves. And we have the ability to take control of our pain ourselves better. We can better manage our pain ourselves through all sorts of behavioral practices. Pain is sort of a whole person experience. And what we know is that how you think about pain affects how you feel it. How you feel pain affects your experience of the pain, and that you can train yourself to think differently about the pain, and that has positive outcomes on how you experience the pain and how intense and frequent your flare-ups are.
Which I find fascinating, and for two reasons really, because on the one hand, there are certain conditions, let's say chronic fatigue syndrome, where cognitive behavioral therapy is not only not necessarily recommended, but there's always that concern that that minimizes someone's complaints if you're telling them to sort of deal with it, right? As opposed to fixing it. But the literature, especially for something like fibromyalgia, is that being able to, not catastrophize the pain, right? To sort of be better able to understand, this is what I have, this is what I'm experiencing, really actually helps with their pain, which I think is really, really important. And it's not saying we don't believe you, you need to learn how to deal with your pain better, but actually learning how to deal with the chronic pain does help. Is that what your work
there are
really
different
shows? Or
absolutely. It's how you think about it and how you approach it that can make a big difference in your experience of it. And so one of the other techniques, in addition to cognitive behavior therapy, is acceptance and commitment therapy that has been shown to be really effective for also managing pain conditions. And it involves really coming to a place where you're willing to have the pain condition simply because it's there, and at this point it's not going anywhere, and live a valued life that's full and satisfying alongside it, that it doesn't have to get in the way or be a barrier to the other things that you want to do in your life, that it doesn't have to impact so significantly the quality of your life. But the difficulty is getting to that place where you're willing to say, okay, I have this, it's going to be with me, now what? And a lot of people misinterpret that as like a resignation or a giving up, or I guess it doesn't matter what I do. And it's a much different process than that. It's an active choosing and a willing to have this be the case for now, because it is, and still live a full life alongside that.